I'm Dr. Brijesh Mehta. I am a neurointerventional surgeon here at the Memorial Healthcare System and the Director of Stroke and Neurocritical Care. As a healthcare organization, when we began learning about this pandemic and the expected surge, our system began planning immediately to ensure the safety of our staff as well as every patient coming into the hospital. And I want you all to know that we've worked diligently with our emergency medical services providers, the emergency room physicians, the nurses, as well as our cath lab staff to make sure that every patient comes into the hospital is safe and gets the necessary acute stroke treatment as quickly as possible. What I love the most about what I do day in and day out is the ability to make a difference when a patient is experiencing an acute stroke. During an acute stroke, time is brain, and what that means is every minute that elapses, millions of neurons are at risk for permanent damage. The data shows that every 30 minutes that elapses, the likelihood of a good outcome if these arteries are not opened up quickly decreases by up to 20%. We have worked with the American Heart and Stroke Association and educated our community on the fast mnemonic, and that means face, arm, speech, and time. If you're experiencing sudden onset of weakness in the face, weakness in one arm or the other, trouble with your speech, just know that time is of essence and to call 911 immediately. A stroke is due to blockage of major arteries in the brain. We have effective treatments in the cath lab that, if administered as quickly as possible when the patients come in, it can be night and day for the patient as well as the loved ones. We've worked diligently to ensure that any patients coming in are immediately screened and tested and that they're not mixed with any of the potentially infected COVID-19 patients. Once they're in the cath lab, we have all the safety protocols, the protective equipment in place to make sure that the patients are treated quickly, but as safely as before. At Memorial, we are a dedicated group of physicians, nurses, technologists, countless individuals who are all working in unison to serve our community. And nothing could be more important than the safety of each and every patient that comes to our hospitals. So I thank you for trusting us with your care.